Hey guys, so we have some news right here about the COVID-19 pandemic that's currently going on, and specifically here in the United States. A lot of us are beginning to freak out because the numbers of people getting tested positive has risen a lot lately, specifically in certain states like New York City, who is the hottest place for this disease in the United States right now. A lot of people are beginning to um get infected by this disease or by this virus, and because of that, all across the country, uh, because the numbers have risen by a lot. Um, Experts are beginning to analyze that if these numbers keep up going up, our premiums, co-payments, and other costs for health insurance is just gonna go up by almost 40%. For example, in here, The Hill has this article by Justin Coltman that says health insurance premiums could skyrocket, and this is the analysis. All right. So in here it says health insurance premiums could skyrocket because of the coronavirus pandemic. According to the analysis released last week, premiums could jump as much as 40% next year if the corona ends up hospitalizing millions of Americans. State insurance marketplace covered by California's analysis warned. The analysis also found that the insurers, employers, and individuals are expected to pay anywhere from 30 billion to 250 billion in additional costs for testing and treating the COVID-19. A liberal estimation will boost the about 1.2 trillion cost per year by 20% or more, potentially leading to a 40% increase in premiums. Uh, Cover California's analysis applies to the commercial insurance market that prevents coverage offered to 170 million workers and individuals through private health plans, but not to Medicare and Medicaid. Peter Billy, the executive director of Cover of California, which was created under the Affordable Care Act (ACA), told the New York Times that 2020 health plans were created without knowing the coronavirus crisis was coming. No insurer, no state planned and put money away from something of this significance, Mr. Lee said. Lee said the boost Lee said the boost in cost could cause people to lose their coverage or go without needed care. He said the coronavirus stimulus package will alleviate some of the burden from hospitals, but may not change how much hospitals charge private insurers and employers for care. In the meantime, insurance and employers are imploring Congress for a reinsurance program for the federal government to cover the most expensive medical claims to relieve them of some of the costs. So, some experts say giant for-profit insurers might have the ability to take on increases of 3 to 4% in the medical cost after their profits in 2019, while jumps of 10 to 12% will be more difficult, according to the Times. But other experts say if people do not seek other medical care, like routine checkups or non-emergency surgery, because of the economic impacts of the coronavirus, the cost of the epidemic could be mitigated. The Times reported the Times report people sought less non-emergency medical care in 2018 and 2008 after the recession. The U.S. has counted more than 125,300 cases of coronavirus in the country, with 2,351 deaths, according to the data of Johns Hopkins University. So there you have it. Well, obviously the numbers are just going up. Let's see right here. The current total confirmed cases in the United States is about 143,000 right now. About 2,513 deaths, and specifically more of them being in New York City, as you see, 76 of those 2,513 deaths had been in New York alone. And obviously, the numbers keep going down as we see the list of this different places in different states with different numbers of deaths. Obviously, this number is gonna keep increasing in the next few days. A lot of us, or a lot of experts, have begun to say that the number could get to maybe 1 million in the next 2 weeks. Hopefully not, but that's a number where they're more likely, they are expecting to get to. Obviously, this is going to get just worse from now on. And this just leads to the question if most of us are gonna pay even more. Right now, a lot of people are very angry because obviously our health insurance system is just not what's it called not affordable for most of us. And imagine now that it's gonna go, the premiums and co-payments are gonna go for almost 40% next year because of the coronavirus. How are we, or what are we gonna do? Are we gonna, people are gonna accept this kind of system? Obviously not, because a lot of people are gonna be out of a health insurance and not cover at all. And this is where something like Medicare Fall makes total sense. Bernie Sanders' plan to cover everyone at a lower cost is what we need now. A program like this would alleviate the problem that we have now of cost. Obviously, a lot of people say, "How are we gonna pay for it?" I was like, "Right now, we pay double. Next year, we're gonna obviously pay more than that." Medicare Fall is something we need. Right now, you saw the stimulus package giving billions, trillions of dollars to the private sector with no attachments, with no benefits for the workers, for the taxpayers, us. We're giving them trillions of dollars for all taxpayer money to these groups, and we're not getting nothing in return. We're just giving them the money with no strings attached. They don't have to give you more benefits. They don't get to give you paid sick leave. They don't have to give you better, nothing in return. We're just giving them the money. We're building them up against us. Just same thing that we did in 2018 with the banks. So this is random sense. We need Bernie Sanders and Medicare for all now more than ever. You see, U.S. health insurance premiums could increase as much as 40% next year if the coronavirus pandemic results in millions of Americans needing hospital stays. Obviously, this is something that we're seeing right now. So what we're gonna do, obviously we have the answer, right? Medicare for all is the way to go, and this is just its popularity right now. It's almost like 60% nationally, and I think it's gonna keep increasing. It's gonna get to maybe the 80s. A lot of us, especially even a lot of conservative Republicans, agree with the idea of a program, government program coming in, as government social program coming in and covering everyone's cost of Medicare, Medicaid, all right? And this is what Bernie Sanders bringing into the table. Obviously, when he says is, okay, we want Medicare for all, and we're gonna expand it by doing how he's gonna do it. He's gonna expand Medicare, Medicaid for everyone. It's gonna start in the first year if he's elected. Is going to start with covering more people from the 50s and 60s, and then every year it's going to come down. Then the next year is going to be people from the age of 40 and 30 that's going to be covered, and the next year so on and so on until everyone is covered. And that's the 4-year plan that he has. A lot of Democratic nominees said, no, that's not appropriate way to go. We still want choice, like people want that kind of choice between Medicare for all and health insurance companies. That's called, they want us think like they want the public option. They want choice between those things, between those two. Like people want to pay more for less healthcare coverage. It's dumb. It's dumb. And obviously we got Joe Biden saying, obviously, and right now he's like, oh yeah, I'm all for the public option and da 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 da. When he has repeatedly in the past, just a few days ago, said, I'm gonna repeal, or if Bernie Sanders does a miracle and convinces everyone in the Senate and the House of Representatives that Medicare for all should be the thing, and everyone, they pass the House and they pass the Senate, and it comes to my desk, I'm gonna veto it. I'm gonna vote against it. Why? Because I don't believe in that. What I believe is we should expand Obamacare, which is what? What does that mean? Obamacare, it sucks. Yes, Obama did a great thing when he said, you know what, insurance companies should not discriminate based on pre-existing conditions. We should allow people to have healthcare. Good. That was a good move a long time ago. But right now, people need more than this bullshit profit system healthcare insurance companies that we have. You know what I mean? People like their service. People like their doctors. We're not going against them. Right? We're just going against the system of how it works. Because I don't have healthcare insurance. You know what I mean? My brother does. My mom does. My dad does because of my mom's work. But I'm not covered. If I get, God forbid, if I get COVID-19 and I start getting the symptoms, I'm not gonna get treated. A kid of 18-year-old kid in LA was tested positive of COVID-19. He didn't have healthcare insurance. He got denied by the ER at the hospital he went to. He came back home, and because he needed a breathing air machine, that every other COVID-19 patient with critical conditions needs, to breathe. He didn't have that because he didn't have he didn't have healthcare insurance, and the hospital said, "No, we don't want to treat anyone without healthcare insurance because we want to eventually get some of that money. We're gonna charge it to someone. So if you don't have anything, more likely if you die, we're gonna stick with the bill. So, bye. So if you don't have healthcare insurance, they're not gonna treat you. They don't care. They don't care. So more likely you're about to die. That kid died. He's gone now. Fortunately, may he rest in peace. But because this is what's gonna happen, a lot of us, I'm sure, don't have healthcare insurance too. And if you get this, your chances of staying alive is very slim. Very slim. So this is why we need Medicare for all. This is why we need someone like Bernie Sanders to lead us there, to lead the way to Medicare for all, because it's gonna happen. You saw it. The numbers are gonna keep rising, and this is just gonna get worse. And next year, if obviously they don't do nothing, the healthcare premiums and co-payments are just gonna go up, and we're gonna have to pay more. And a lot of people are gonna be uninsured, leading to the situation we are right now. People not having insurance. Disgusting.